Walkers, runners, and cyclists in Kilgore have few options when it comes to choosing where to go. Mariah Van Dorian runs 3 miles twice a week. She wants a new place to run other than her neighborhood.
Straight road, a couple circles every now and then, but the same thing the whole time. And then back home again. Doesn't provide much excitement in running.
A recent study from Stephen F. Austin reveals that walkability in Kilgore is poor. City leaders have made it a goal to change that by applying for a grant from the Texas Parks and Wildlife. If approved, the city will begin building the 7-mile walking trail, stretching from Synergy Park all the way down to Kilgore ISD's new school campus. Kilgore's Director of City Planning, Carol Wyndham, says the trail is needed.
Our trails that we have currently are used on a regular basis. They're very crowded most of the time.
The total cost of the project is estimated at $1.3 million. The first section of the trail to be completed will be Phase 3, a section between Meadowbrook Park and Dudley Road. Carol Wyndham says with this new trail, it'll provide Kilgore residents with more than just a trail that circles around a park.
A more scenic atmosphere along the river would be very beautiful.
The trail will be 10 feet wide and made of concrete or asphalt and run along creeks and streams, an upgrade from these current trails. In Kilgore, Gregg County, I'm Kevin Boyce, KYTX, CBS 19 News.
Anthony, it's called Good Shepherd Medical Associates, and the doctors and healthcare providers who have joined this new alliance say it's going to be more efficient and less costly for East Texas patients. Dr. Bill Torres, a Longview gastroenterologist, is also a board member for Good Shepherd Medical Associates, a coalition he says was years in the making.
I know I entered the conversation in 2010.
As changes in federal healthcare laws take effect, doctors and health systems like Good Shepherd are looking for more of a team approach in caring for patients. So Tuesday, Good Shepherd Health System announced the formation of this new group. It teams more than 120 doctors and mid-level healthcare providers in at least 20 specialties, ranging from family medicine to cardiology and psychiatry.
We'll work more closely together, not only together, but also with the hospital in order to provide efficient, higher quality, better service in the delivery of medicine.
This is how Good Shepherd officials say the alliance works to better serve patients. Under a traditional system, the patient has a primary care physician, and that primary care physician may refer the patient to a cardiologist or a pulmonologist. However, any communication between these doctors pretty much has to go through that patient. Under this alliance, the patient, of course, communicates with their primary care physician, and that primary care physician not only refers the patient to a urologist, a pulmonologist, a cardiologist, but they are all within this network. So whatever needs the patient may have, they have that technology and that network to be able to communicate better, and thus it's more efficient and less costly.
The current changes in healthcare, this is the trend of the future, is for physicians and hospitals to become more integrated and work together more closely.
Gary Smith attended Tuesday's press conference announcing the alliance. Smith is a city councilman serving District 2, a working class section of Southwest Longview.
If you're a doctor, your physician can recommend you or prefer you to somebody in a Good Shepherd health system. I believe it benefits not only the patient themselves, but it also benefits the hospital.
And Good Shepherd Medical Associates will serve not only the hospital communities of Longview and Marshall, but 13 other East Texas communities. Reporting in the Longview newsroom in Gregg County, I'm Jimmy Isaac, KYTX, CBS 19 News. Back to you, Anthony.